North Carolina officially moved into vaccinating Group 3 this week, starting with teachers and other educators who are part of our essential frontline workers. And next month, the state will open vaccination appointments to the rest of that essential workforce. Maureen O'Boyle joins us now live in the studio. And Maureen, we're hearing from a lot of people who want to know who is included in this group.
That's right, Molly. The questions to the vaccine team have been very similar. Kelly asked, during the shutdown, places like Home Depot and Lowe's were considered essential and open. Are their employees now eligible for the vaccine? Kelly, the state says no, not yet. Those retail employees will be part of Group 4. Right now, as Molly said, we're on Group 3. Teachers are getting priority, but starting March 10th, other essential workers will be eligible. That includes people who work at restaurants, grocery stores, and meat packing facilities. Also members of our law enforcement who work in public transportation, I should say, as well as people who work in critical manufacturing. That brings us to our next question to the vaccine team. A woman wrote, my husband is an essential manufacturer worker in Charlotte, North Carolina, but we live in South Carolina. Will he have to wait to get his vaccine in South Carolina? And the answer is no. North Carolina will vaccinate people who live in South Carolina and work here. The state was given the option by the CDC to restrict vaccinations to people from out of state because people were traveling here to get their shots. But Mecklenburg County and the state have told us they are still vaccinating people from South Carolina, especially those who work here in North Carolina. The vaccine team is committed to answering your questions. If you go to WBTV.com/vaccine, you can click on the red bar at the top. That will take you to the page where you can submit your questions. You can also send us an email directly to vaccineteam@WBTV.com. We'll continue answering them on air and online.